Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 258 of the Ask Dr. Angela podcast. Oh my gosh, has it really been 258 episodes? Doesn't even seem like that. I guess time passes quite quickly when you're having fun. Anyway, it's finally snowing here in Jersey. We canceled, the offices today. No office hours, although I was going to be off anyway. But the snow finally has started coming down. And I got to say, it's not nearly what I thought or I think what any of us expected. So we'll see what the final accumulation ends up being. So it's been like a good day to be inside. I was hanging out with the dog. My 8-year-old, who happens to be on spring break, made me a wonderful breakfast. Hash browns and hard-boiled eggs. Loved that because it was made with such love. And I'm just really happy to be here. Morning got off to a great start. Today's blog post actually is what we're going to focus on in the podcast today. And I got to tell you, I so enjoy writing the blog posts. They're fun, they're witty, they're humorous, and it's just another avenue for me to not only entertain and amuse myself, but to inform you all about what's going on in the realm of OBGYN. So, funny story, the hospital that I currently practice at, and I'm not going to give them a shout out, but if you know anything about where I am, you can probably figure it out. But they recently passed kind of this dictate on labor and delivery stating that there were not going to be any elective inductions allowed prior to 40 weeks gestation. The reasoning behind this was because the C-section rate is higher than they would like it to be. And so, this isn't something that's backed by ACOG. This was just a policy that, the folks on the committee of the Department of OBGYN thought was going to be in the best interest, again, to reduce the C-section rate. So lo and behold, last Sunday I'm minding my own business, chuckle, and I finally have an opportunity to go through my magazine rack in my office. And I got to tell you, during the course of a week, I get lots of magazines, journals, newspapers, etc., all pertaining to OBGYN, what's going on in the field of obstetrics and gynecology. So I sit down and I see this article, and it just makes me smile so big. And the name of the article is Induction at 39 Weeks, No Adverse Short-Term Effects on Outcomes. And the reason that this is so significant is that the article talks about a pretty large study that was conducted, and it basically stated that, in conclusion, that elective inductions at 39 weeks gestation were safe for both the newborn and also provided benefits for first-time moms, in that it reduced the risk of C-section delivery by 16%, and it also reduced pregnancy-related hypertensive disorders by 36%. And that's when you compare those women that underwent elective inductions at 39 weeks versus women who were managed expectantly. Pretty interesting stuff. So I smiled because here's an article that sort of disproves that which, the hospital that I practice at is currently trying to improve. Elective inductions at 39 weeks, according to this article, does not increase the risk, C-section rates, and also decrease the risk of hypertensive disorders in pregnancy. And you all know, during pregnancy, we're always concerned about hypertensive disorders. Preeclampsia or gestational hypertension are the two that specifically come to mind for me. So when you start talking about induction of labor, it can be a very sensitive topic. And I have to be completely honest with you. As I stated in the blog post that went up today, and if you haven't read that, you really should go to the website, askdrangela.com, and check it out. But, I think that in my own practice, I tend to be kind of more hands-off, and certainly the American College of OBGYN tends to be more hands-off in that they don't really recommend elective inductions. without, or I guess I should say they don't really recommend inductions unless they're medically indicated, which basically, if you leave it up to ACOG, they are very clear in their stance. They have I think they call it a Choosing Wisely campaign, where again, they're very clear in stating that they're against elective inductions of labor unless they're medically indicated. My whole thing on this is I'm in the middle. I'm kind of in the middle. I mean, I am kind of a hands-off kind of gal when it comes to managing pregnancy, labor, delivery, etc. I guess that comes from me being trained during residency with a bunch of midwives. I love midwives and what they bring to taking care of expectant moms. I would say that I do prefer more of a hands-off approach. Having said that, if I do have a mom that is 39 weeks, at least 39 weeks, and she has what's deemed to be a favorable cervix, then I certainly would not have a problem inducing her. The problem becomes when you start inducing folks for, number one, convenience. A lot of physicians were inducing patients, to coincide with their vacations or time off or dinner times, golf times, whatever. Or when you start inducing patients whose cervixes are not what we call favorable or ripe. If you want to be technical about that, when we talk about cervixes being favorable, we look at a couple of different things. We look at dilation, position, that being whether it's anterior, posterior, mid position. We look at consistency, i.e. is the cervix firm, is it soft? We look at effacement, or how thinned out the cervix is. We look at the baby's station, i.e. is the baby engaged in the pelvis, etc. And based on all of those things, we come up with a composite score. It's called a Bishop score. And if that score is less than 6, that's considered unfavorable. And when we start saying unfavorable, that means that it's unlikely that you're going to end up with a vaginal delivery, that the induction is going to end up in a vaginal delivery. And so, on one hand, I do understand the argument about not inducing folks whose cervixes aren't favorable. I mean, we've all seen it. You're being induced, whether it's elective or medically indicated. If your cervix is not ready, that induction can take hours, days, and what ultimately seems like an eternity. And sometimes, inductions do end up in C-sections, which is not what the goal is here. So I think that, again, if you haven't had an opportunity to check out today's blog post on inductions at 39 weeks, I think you should check it out. I do like that this study was published. It gives some really valuable insight and information. And it's one of the things that I really love about practicing medicine is that medicine is constantly evolving. It's always changing. And when you get studies like this that provide pretty clear data on a certain topic, it's up to you as a clinician to decide. So it's up to me to decide, how I'm going to use this information. And the reason that I'm presenting it to you, the general population at large and women at large, is so that you will be able to make an informed decision if the topic of induction comes up during your care. Informed decisions are the best decisions. Like my favorite guy, G.I. Joe, says, knowledge is half the battle. Knowing is half the battle. So anyway, go to my website, www.askdrangela.com, and check out this particular blog post on induction of labor at 39 weeks. Is timing everything? And let me know what you think. If you've had an induction, I'd love to hear how it went for you. What were your thoughts? How was your experience? Etc. I can't wait to hear from you. Thank you so much for tuning into today's podcast. You know where to reach me. I can't wait to address any and all of your future questions. And believe me, they are coming in like so frequently. I have so many emails, direct messages, etc. on my social media. I'm on Instagram, Twitter, Facebook. So I'm everywhere. In closing, I want to leave you with a quote from one of my favorite books, She Went Out on a Limb. It's by Sandy Gingras. And it says, she went out on a limb, had it break off, and realized that she could fly. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 259 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.